A lot of people would prefer getting into a residency program in the US, that is the master's program, instead of the DDS. So today we have with us Dr. Radhika Thakkar, who's going to tell us about her journey of getting into residency in the US after her BDS in India. After completing her BDS in India, she got into private practice where she worked for 5 years. She then moved to USA where she first completed her master's in public health from the St. John's University, New York. She then completed her research fellowship and 2-year AEGD residency program in the University of Rochester. Her hard work and her interest in both the clinical and research aspects of dentistry has got her the GME position with faculty currently. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Tucker. Thank you for joining us today. My first question to you is, what are the various fields in which residency programs are available in the US?
So thank you for inviting. So I would like to start. So first is AEGD program, which is Advanced Education in General Dentistry, which I highly recommend for people who have BDS and who doesn't have any master's program. So that is number one. Number two is GPR program, and there is actually only one GPR program which accept international dentists, which is in Virginia, and I'm going to share the list. Number three is dental public health residency. So that dental public health residency previously it was open to 8 states, and now it is open to only Vermont. But the good thing about dental public health residency is you can do it after MPH, because most Indian dentists who come to United States, they already have an MPH, and they can do just 1 year of dental public health residency, and they can become a licensed dentist in United States in one
Okay.
state, but it is still feasible, and it is still possible. And then you can reciprocate your license in other states after practicing a couple years. Number four is orofacial pain residency. So for example, if you already have some masters in oral medicine or oral radiology, then this would be the ideal smooth transition for your career to do this. And for example, if you don't have any masters or other experience related to orofacial pain, then I would highly recommend to do preceptorship program, minimum of 6 months in orofacial pain residency specifically. That way you are exposed to orofacial pain, and that way your chances of getting acceptance are high compared to other students. So that is that. And after that, that comes the perio, prosto, ortho, endo, all of those except oral surgery, oral and maxillofacial surgery. So all others you can apply. There are 700 total programs in pass application, but there are very few master's residency programs where they do accept international dentist without DDS or without advanced standing program. So for example, I would say that for MS residency in prosto, there is University of Alabama, University of California, University of Connecticut. There are some Nova Southern University, University of Maryland, and maybe I would say Harvard School of Dental Medicine, NYU, and Ohio State University. I will share detail this later on. But for this master's program, you have to know that to get acceptance in perio or prosto or whatever the specialty, those are very competitive. They want people who are actually passionate about that particular field of dentistry. And for that, even if you're hardworking, you still have to prove them according to US standard. Like why perio, why prosto? What you have in your resume, which would make you an ideal candidate for their program. So make sure to have realistic expectations, and do your homework and apply appropriately to your
Understood.
fields and to the program requirements.
That's a very good point because a lot of people think I'll just apply into the first university and I'll get through. So, what she's told, have realistic expectations. If you have a specific goal that you want to get into that kind of program, you will have to work accordingly as well. And the entire list of the various universities which she's created, we'll be posting it as a collaboration on our Instagram page. So, you can go there and check it out. You'll get the entire list of universities in which the various master's and residency programs are available. She's done a lot of effort in coming up with that entire list. So if you're interested, don't forget to go and check that out. So now we know the various residency programs which are available. So what is the general cost if I want to get into one of these residency programs?
So general cost, on a broader level, it is much, much less compared to DDS. Why?
Okay.
Because in DDS, it is approximately $300,000 for average cost of advanced standing program. And for residency, it starts from stipend. Some of us, there are two residency programs who does pay stipend of $60,000 or $50,000 per year to the resident. And the minimum cost of tuition is $30,000 per year, and it can go up to like $60,000 per year. So, but still, which is so much less compared to advanced standing and DDS program.
Understood. So it's a major difference. So if you are able to get into a residency program, it is more easy on your pocket, but it is not very easy to get into the residency program. You have to prepare accordingly. So you've already mentioned scholarships are available. That stipend is available in two programs. Are there other scholarships other than stipends in these residency programs?
Usually, which is they are not available for non-citizens.
Okay. So most of the people who have done their BDS in India or in the South Asian countries won't be applicable for the scholarship programs. Now you spoke about GPR and general dentistry residency programs. What are the different general dentistry residency programs there, and what are taught in these courses in general dentistry, masters or residency programs?
Yeah, so the basic difference in AEGD, which is Advanced Education in General Dentistry, and GPR, which is General Practice Residency Program, is, by the way, I'm doing both. I finished my 2-year AGD, and right now I'm in GME. So I have experience of both of them. So to begin with, the basic broader level difference is in AGD, we do a lot of clinical dentistry. I mean to say bread and butter dentistry, and like implants, crowns, root canals, composites, extractions, but not too much sedation. So, in compared to GPR residency, we are exposed to more of a hospital-based dentistry, which I mean to say is sedation, nitrous oxide sedation, or IV sedation, or we also are on call rotation for GPR. So, for example, if there is a fracture or accident middle of the night, and you are also on the call with other medical doctors, so you work in a bigger teams with anesthesiologists, medical doctors, oral surgeon, medical surgeon, and dentist, so and nurse and all of that. So you work in a bigger picture, and in GPR also they have a different rotation. So you are not doing same thing every day for 1 year. So in GPR, you might have a rotation in general dentistry also as a part of GPR. So you would do bread and butter composites and basic dentistry also. Plus, you will have a rotation in emergency dental care too, and you will also have a rotation in a hospital department too. And whenever we have a rotation in a hospital, usually we are the side people, and other medical doctors and other people take care of it. And if they have very specific dentistry, then only we usually jump in and give our 2 cents in that situations. So an other important thing to note, as this is just what I gave you, is the overview of difference between AGD and GPR. Not all AGDs and not all GPRs are same. And other thing is, AGD program, there are 10 AGD programs who does accept in United States for foreign trained dentist. There are more than 300 programs, but only 10 are accepting foreign trained dentist without DDS and without advanced standing DDS program. And for GPR, there are maybe 1 or 2 programs who accept foreign trained dentists without DDS and DMD. However, if you do advanced standing or DDS program as a foreign trained dentist, all the GPR and all the AGD programs in United States are open for you. So after advanced standing DDS, everyone can do AGD and GPR, and which is typically very easy to get into after you have a DDS.
Got it. Because
Typically, this
there's lesser competition there, and then you can just streamline your work skills by getting into it after you finish your
yes,
DDS program.
yes,
Got it. So now you did MPH between your
yes.
BDS and residency, and now you're finished, you're doing a second residency program. So my question to you is, would you advise people to do MPH between their BDS and residency, or directly try getting into a DDS or residency program?
Are you liking this video so far? If yes, do not forget to hit the like button below because it helps YouTube realize that you like such videos where you want to grow your career, and it will keep showing you more of these. So do not forget to hit the like button.
I would like to start with given a choice. So if I have a choice, if I had a better understanding of United States education system and admission, I wouldn't do it. But given for example, if you are new to US and you haven't seen this video, or you haven't been exposed to other doctors or other people around, there are better ways to improve your resume, and there are better ways to come to United States without doing MPH, you know. So for example, okay, let me start with what is the right scenario for MPH, why it is good for you, you know, positive side of MPH. Number one is a student visa, because if you are coming to United States, you cannot stay here longer on visitor status, right? So you cannot
Yes.
stay here more than 6 months on B1 B2 visa. So I already had business visa for 10 years. So before I came here on F1, I came to United States in 2015 for a dental course at NYU, and I came on business visa at that time. So I'm aware of that. So the thing is, if you want to come, you need student visa, and a master's in public health is the faster, easier, and like almost best way to get it. Other thing is, what are other good ways to do MPH is, if you really want to consider MPH as your backup career, if you really want to consider it as a, you know, maybe if you don't get into DDS and you don't want to bother, you don't care too much, and you like MPH, you like to do broader scale of healthcare, you like to do epidemiology, you like to do healthcare policies and all of those things, if those are passionate for you, go for it and do it really good, and do research, do everything good, and make a good career. You can still make a lot of money, you can still make 100K after MPH if you're really good at it and if you like it. So that is one good reason to do MPH. Another good reason could be you can do dental public health after MPH, because in dental public health, MPH is the prerequisite to do dental public health. So MPH is mandatory to get accepted into dental public health residency. And
Understood.
after dental public health residency, most people don't know, but they can get the license to practice as a dentist right now in Vermont. And other thing is, if you don't want to practice as a dentist after dental public health, you can work as a faculty in university after dental public health, and you can still make more than 100K. Full-time faculty, and those are not limited to states. For a faculty license is different compared to dentist license. Working clinical license is different compared to faculty one. So after dental public health residency and a master in public health, you can work as a faculty in all the states in United States, everywhere, and still make decent money and make a good, stable, safe, secure career. So those are good things about MPH. But for my case, I never liked MPH. I just had to do it, so I did it. So in the beginning, I hated it. So even today, if I have a choice, I might do more of a clinical preceptorship, so which is 1-year programs. So that was, I wanted to do it from the beginning, but I didn't know if it is a good idea to get a visa, or I didn't know too much details about it. So for that, if I was citizen or something, then I would do clinical preceptorship.
Understood.
1-year clinical preceptorship in specifically perio or prosto, because those things I love it. I love perio prosto. So I would have done perio prosto preceptorship at that time. So that is
So
one of the things.
preceptorship will help improve your resume similar to MPH. What are the
Uh,
other ways other than preceptorship one can improve their resume?
so if you compare MPH and preceptorship, according to resume perspective, preceptorship is here and MPH is here.
Okay.
Why? Because most of residency program, they care about bread and butter dentistry. Because they have Medicaid patients, they have ton of patients, and they want people who can take care of patients in clinically. So if you do clinical preceptorship and you have a lot of experience hands-on or something, they would like it. They
Got it.
prefer that one. So, and in preceptorship, other good thing is you are still inside dentistry. You are part of dental team, and you can network a lot. You can meet a lot of faculties, deans, director within dentistry, and those are your strength. If you build a good reputation in preceptorship, you can get an amazing letter of recommendation, and that can make or break your career. So
Got it.
other secret thing about letter of recommendation is, it is not about what is written inside. It's not about 5 paragraphs. It is about who wrote the paragraph for you. It is not about your friend or other doctor can praise about you, all the sparklies and everything perfect about you, sing songs about you, but that doesn't matter. But if university dean in US, not in India, we have trust issues in Indian letters in US. So not that, but in US, if you do preceptorship in New York University, for example, and if New York University dean or director writes you a letter of recommendation that this person has did amazing in preceptorship, this person did courses, presentations, participated in activities, everything, even if it is one paragraph, that has more value compared to other things. So
Got
that letter of recommendation. So for example, New York University is good with University of Buffalo. Both are in New York State. So if that New York University letter goes to Buffalo University, they respect it. They know
Understood.
that this person has done well in this one, and this is credible person. So there is instant win in your application. So that is
Got
how
it.
it works.
So other than preceptorship, anything else to improve the resume?
Before you listen to the answer to that question, are you interested in taking your career to the next level? Then, what are you waiting for? Go and subscribe to the channel below because this channel helps you learn and grow in dentistry.
Yes. So other thing is nowadays a lot of universities ask say that ADET. They say it preferred, but preferred is just a polite way of asking that we like it. So so many universities, they don't have it mandatory, but it is better if you have aided, and it is better if you have a higher score. So that is that. And TOEFL high score is better. More than 100 is almost very important. Higher the better, and TOEFL is something you can give it unlimited times. Then why not try to get higher, and why not try to get best of it, because GPA we cannot improve. What is done and dusted, we cannot go back and change it, right? So those things are important. Other thing is nowadays digital dentistry is in the trend. So if you can do not the online one, not the online 1 hour free CE courses, I'm not talking about those. I'm talking about hands-on courses, or anything about digital dentistry, CBCT, implants, veneer, cosmetics, Invisalign, all of those. So there are two ways to get experience about digital and fancy things in dentistry. One is to spend money and do hands-on courses, right? And there is another smarter, easier, student-friendly, affordable way, which I did it, was to find an office, dental office, where they have all this technology,
Got it.
and work there as a dental assistant. That way, in a student budget and a friendly manner, the dentist gonna train you, teach you, give you free CEs, because they have a package. They have spent $200,000 in buying CBCT machine or a CEREC machine for a crown milling and scanners and everything. So if they have spent $200,000 in the technology, their company give them a lot of free CE courses to teach their staff members. So when you work there as a staff, as a dental assistant, you get access to a lot of free CEs, which are new latest technology. So this is what I did. I just Googled that digital dentistry and CEREC scanning in my city. I live in Rochester, so I just Googled and I just made the list of dental offices who has highest number of technology. I created the list who has CEREC, in-house same crown, in-house milling machine,
Understood.
in-house scanner, CBCT, Invisalign, and I think
So
something
you
else.
searched an assistant job and you researched who had all those things so that it'll be easy for you to learn from them directly rather than
Yes.
spending all that money and doing the courses yourself. That's a
And
very smart trick. A lot of young dentists, I think, cannot think about it. It's very smart of you. So you're
yes,
giving us a lot of secrets which people usually will not think of. Okay.
because I have to find student friendly things, right? Because when we come to US, we don't have all the resources, and we still need to
Absolutely.
survive. We need to make
Absolutely.
money. We don't have money to spend in $5,000 weekend course and learn nothing,
Got
And
it.
anyway, in 2 days, you cannot learn everything. 2 days of
Yes.
CE is not enough.
Understood.
So,
So you
so
found the
those are
smarter solution. Great.
getting paid and free training and getting paid and unlimited practice. So when I
Understood.
applied for residency program, I had a report from CEREC machine, how many crowns are milled in that machine in that month when I was dental assistant. So I
Understood.
printed that report and I did almost 250 crowns.
Great.
And I designed it, milled it, and scanning, milling, designing, and painting, and all the glazing and coloring and
Understood.
everything.
Understood.
And I took pictures of a crown. So that way, and I
So that's how you made your resume stand out basically. By you did
yes,
dental assistant program, you did an MPH, you did preceptorships, you did the entire thing so that your resume stood out when it came to residency. So all the viewers remember you have to add as many layers of skill sets so that your resume stands out when you finally apply. That's a very good suggestion. My next question to you is, now you've finished your residency. Okay. Can you practice in all the states?
So the thing is, as a AEGD resident, I can practice in 11 states. And for New York and California, I need to do one more year of GPR or GME residency. So right now I'm in GME residency. I finished my 2-year AGD because I want to stay in New York. That's why I have to do this extra unnecessary step. Otherwise, I wouldn't need it.
Understood. And for the viewers out here, we'll be putting the rest of the list of where which residency programs help you in our Instagram collaboration. So do not forget to go and check that out. So now
And
you're
before we sign out, I want to mention one more thing that I forgot. The biggest part is research that I didn't mention earlier, uh, which is to improve your resume and to stand out. Specifically, if you are a dentist from India, we are not exposed to research. So, and another sad thing is Indians compete with Indians because when they get applications, they have 70% applications are from Indian dentists and 10% maybe from Brazil or China or Cuba or
understood.
Spain or other Romania or some other countries, and the Indians have highest competition among each other. So to stand out between that, if you do research, that would improve your chance amazingly. For example, how to do that? First is research publication. Publication, write a research paper, collaborate with your professors, and if you want, I'm happy to help your viewers and everybody because I'm still part of research and I have like 35 publications. I'm still doing it because to be honest, I need it more, I love it more, and I want more promotion in my job, and I want to grow in my career. So if anybody wants to participate in research publications and take part, I'm more than happy to help all of you. And you can check the link in bio in my Instagram, and I have free consultation link. You can book my consultation, and I'm more than happy to help.
That's
Another thing for
really generous of you.
because I've been there, right? I've been through all the struggles, and I never wanted to do research and all this extra. All I wanted to do was extraction, crown. I just wanted to do clinical dentistry. I never wanted to do nothing else. But
Understood.
it just happened with circumstances, you know.
Got it.
So I'm happy to do that. Another thing that you can do when you are in India to stand out is you can participate in Indian Dental Association or any FDI or FemDent or all other post events like conferences and do poster presentation. Be a speaker, have a habit of going out of your comfort zone and do something little extra, you know, other than your regular things to do. That one you can do it in India in conferences, and also when you move to US and when you are doing MPH or preceptorship or just being a dental assistant, whatever you're doing, still participate in dental conferences, not just as a viewer or audience. Do a poster presentation, and when you do poster
So basically,
presentation,
they
you
need to be actively participant, not just like a viewer. So either poster presentations or
exactly.
paper presentations will help them upgrade their skill, plus also add to their resume.
Another free thing is when your poster is accepted for presentation, you get free registration for a conference. So basically you are contributing as a knowledge as your knowledge, and they give you free registration and everything, and also register for a free volunteer in a conference. So when you participate in a conference in two ways, one is poster presentation and one is a volunteer. And in volunteer you can also participate as a host volunteer. So for example, you are the one who coordinates with other big speakers and big names. So if you get opportunity to be a volunteer coordinator, that would give you VIP pass to launch, VIP pass to meet biggest famous dentist speakers, and that way you can do networking, collaboration free of charge.
That's
And
really good advice out there. No, it's actually good advice.
this
Uh,
student friendly advice, you know.
Absolutely. And the entire conversation you have given it from their perspective, like what they can do and they can do. So I think you've given us a lot of advice. Still, to wrap it up, is there any one point you want to advise someone who is watching right now?
Stay out of your comfort zone. In this, if you come to US, just try to every day ask yourself one question: am I doing better than yesterday? Am I improving? If you keep doing same thing, then nothing gonna change for yourself. And be realistic and don't be afraid to ask for help. There is nothing wrong in asking for help. Don't be shy. If somebody has done it, then ask that person. You know, be smarter. You know, as an Indian, we work hard. It is in our DNA to work hard. But now is the time you have to think, work harder and work smarter, and maybe a little show off. Whatever works for us, just do it. Don't take it like, oh, why I have to go through this? Why I have to go through this? This is business. This is life is practical. Get over it. Forget your frustration. Keep everything aside and focus what to do next. That's it.
That's a really amazing advice. So I would like to end it here, Dr. Radhika. Thank you for your time. The conversation was amazing. There's a lot of content you have come. We'll be putting that on Instagram as well. And I'm hoping to do this conversation with you again because you have a lot of knowledge for someone who wants to make the leap. Thank you for joining us.
Thank you.
If you like this video, do not forget to go and check out our entire playlist of USA After BDS, where we discuss the process of getting into residency or DDS as well as interview other people who have done so successfully.